So you know the old saying about plans, no plan ever survives first contact with the enemy. How did your plan do when it contacted the coronavirus?
Well, David, you're exactly right that this plan did not survive contact with the enemy, but that is actually a positive thing in the sense that I think what we've been able to do is demonstrate our agility. We know going in that we have the plan is just a point of departure. It's a place to start with, and then we'll adjust fire to do what needs to be done to get the mission done. In this particular case, as we've seen in New York City, there has been a fantastic response from the Department of Defense to provide medical assets within New York City. But our initial idea of going in there and kind of being the relief valve to do the non-COVID did not last very long. And what I'm really proud of, though, is that we changed that. In fact, we changed that in a matter of days. And so when we got there, in response to what the actual mission we were given was to do the non-COVID, we immediately started contacting the local city officials, the state officials, the HHS officials that were on the ground, the FEMA officials there to really understand the operating environment we were in there. And I think that was the key to our adaptability, is that we were able to not just go in with the mission and stay true to that mission, but actually look actively to get involved with those that have been working already in New York City. And very quickly, we determined that we needed to adjust a fire. And I'm really proud of the team's ability to respond quickly and adjust that.
So who was it that told you it wasn't happening fast enough in New York if you waited for the patients to come to you?
Well, there's a myriad of different conversations, and we were burning the phone lines up here as well. I'll use an example of the Commissioner for Emergency Management is Deanne Criswell. Become actually good friends with her over the last several weeks, just as we've talked so much and working with her. But she was very quick to point out that what we were trying to do with our non-COVID approach was just not going to be successful, was not going to meet her needs, despite the fact that that was what our mission requirements were. But I use that just as one example, but there's a myriad of officials that we were dealing with, truly trying to understand it. And our goal in all these is not to be an addendum to a hospital management system, but we want to immerse ourselves in and be part of that hospital management system. And that's where folks like Deanne Criswell were really helpful for us, so that we're now part of the system. We're not an addendum to it, we're integral to it. And now we find that success where we're able to provide that support to New York City in the most effective way.
But isn't the downside of that you expose your own people to the virus and then decrease the readiness of your own units?
They're certainly not without risk, and we went into this with open eyes. Our healthcare workers all across the nation are exposing themselves to this risk, knowingly going into environments that put them at risk personally. And so our military healthcare workers are no different. And I'll tell you, when I talk to the actual healthcare workers on the ground now, they, one, understand that. Two, they are very enthusiastic about being part of this national response.